Now we're looking at phase 1 and phase 2 oromaxillofacial surgery. Phase 1 over on the left hand side, sagittal split on the mandible, bring it forward, and here we have a genioglottal advancement as well. So it impacts on the hyoid, and typically a segment of bone is taken out on the inside of the chin, and then the bone is turned through 90 degrees, reattached with plates, shortens the hyoid, shortens the ligament, and then actually that advances the hyoid and actually pulls open the airway. And you can see there, it could actually be done without mandibular advancements as well. Over on this side we have a biomaxillary osteotomy, moving both jaws forwards, and again accompanied with genioglottal advancement of the hyoid. Sometimes this part isn't necessary because you've actually brought the lower jaw forward. It actually has enough impact. To do that as well, you really are tremendous advancement on the hyoid in this, I think, oropharyngeal, hypopharyngeal area. Okay, so let's wrap this up. Well, we've covered snoring and apnea patterns. We've covered the sleep-related breathing disorders related to medical conditions. And we've looked at the pathophysiology of OSA and the consequences. And we've looked at the management of SRBD, sleep-related breathing disorders. Okay, now I'm going to show you a video, the straight, honest truth about sleep apnea and CPAP. Interesting viewing. The man gets very passionate, but he's trying to talk to the general public. You may find this useful, you may find it interesting, you might find it amusing.